Hi guys, so the former Health Secretary and current shadow in the Conservative Party, Victoria Atkins, made a bit of a fool of herself when she appeared on the Trevor Phillips show on Sunday and spoke about the NHS. She attacked West Streeting for claiming that the health service is broken and that the blame lies clearly with the previous government. She claimed that the problems facing the NHS are down to issues beyond the control of the Tory government of the time, and she also lied about a pay rise for doctors. Have a listen to this.
And I think what we need to have now is a sensible conversation about the future of the NHS. As Secretary of State, I would come onto your programme, Trevor, and be very open about how, of course, the NHS is facing long-term pressures and struggling with many of them, as other healthcare systems are around the world. So we know the pressures that the fact we're all living longer is placing on the NHS. We know the fact that we're living with more multiple long-term conditions that require care and medicines. That's placing a pressure on the NHS.
No mention of your party's decision to run the NHS into the ground, not to provide it with enough funding, and whenever funding was provided, it went to the private sector. No, offloading responsibility onto, well, people are living longer and people are coming forward with more complex health issues that need to be dealt with. Like, you can't turn around now and say, well, there's nothing to do with us, it's to do with people living longer. Yes, but your party was in power for 14 years. These issues didn't come down with the last rainfall. These have been issues that governments have been looking at, or should have been looking at, over the last decades.
There are also pressures such as, for example, the impact of social media and how that is shaping young people's minds, something that we are all very concerned about. And I was clear as Secretary of State that to build an NHS for the next 75 years, we have to marry reform with investment. And I tried to do that through the productivity plan, which I understand, the tech plan, bringing tech to the front line of NHS services.
Okay, tech has a role to play. But as was mentioned in a previous video, tech is not the solution. We heard from a doctor who said, look, we can use technologies like Zoom and apps and stuff like this and AI, but we can't rely on that fully. We can use it as a tool, but it's not suitable for all patients and all scenarios.
But which I hear that Labour is cancelling. And what worries me is what we've seen so far from the Health Secretary. The only thing he's done is to give junior doctors a pay rise with no product.
It's not a pay rise. It's a partial restoration. The doctors have not received enough money for the last number of years since you guys got into power. And what the new Health Secretary has done is given them a sort of a restoration, not a pay rise. It's a sort of restoration to bring them up to a decent level. I don't know if it's actually enough to retain staff. It may be necessary to give them more next year to encourage more people to join the profession, but also to retain the staff that currently are considering leaving over paying conditions.
Productivity
well, let me stop you there. I can hear viewers yelling, Streeting's come on and he's blamed you lot. You've come on and now you're blaming demographics and the past. And you had 14 years to deal with some of these problems. You left the legacy of 100,000 infants waiting more than 6 hours in A&E, 60% rise in waiting time for infants over the past 15 years, 800,000 young people on NHS waiting lists. As I said to West Streeting, his decisions are on him. And your record is on you.
I completely agree with that. And Trevor, by the way, I wasn't blaming demographics. I'm explaining the pressures that our NHS is facing.
But you had 14 years to anticipate and to address it, and you didn't.
If I may just deal, first of all, with infant A&Es. We know infant waiting times in A&Es. One of the last things I did as Health Secretary was to approve a vaccination for a horrible winter virus that can be very, very dangerous for babies and for older people, called RSV. I approved that vaccination to be rolled out this winter.
Did she actually listen to the question or listen to the point that was raised? It was about infants in A&E, the waiting time for young people at A&E. And you're talking about vaccines. You're talking about a rollout. Did she actually listen to the point that was raised here?
because we know that if RSV strikes, then that will add enormous worry for parents, but also adds pressure to the NHS. I've also sought to try and improve vaccination rates for things like measles, because again, if we can prevent these illnesses from happening in the first place, not only is that, of course, much better for families, but it also takes the pressure off the NHS. And the figures that have been referred to in this report, we think, although of course I don't have the data and I haven't seen the report, but we think that may be related to that spike in scarlet fever. Do you remember when parents were very worried about their children, bringing them into A&E? And so these are some of the pressures that the A&E...
Oh my God, you're talking about things in specific, but not in general. The problem is the NHS is struggling in general. There may be areas where it's doing really well. Great. But in general, it's been run into the ground. Now, your party decided we're not going to fund public services enough. We're going to allow the NHS to rely on the private sector, and patients who can't get access to the NHS, well, we'll just rely on the private sector there as well. This was a political decision. This was not by accident. This was calculated over 14 years. We're going to run the public services into the ground, including the NHS, so that people will rely on the private sector. The Conservatives' goal is to reduce the size of government. Well, that's the ideological goal. And privatise as much as possible. Now, not all of the NHS will be privatised. That must be remembered, because some of it is not profitable. The profitable parts will be sold off, and have been sold off to a certain extent, to the private sector. They want to sell off as much as possible, or they wanted to. Some parts cannot be sold off. Some parts are not profitable. But this government, the last Tory government, was not interested in dealing with the problems facing the NHS. They wanted to show the public that they were, but in reality they were not. And it's going to be a massive mountain to climb to fix these problems if West Streeting is actually serious in doing that. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.